This video will focus on the documents needed for vaccination. The federal government is providing COVID-19 vaccines free of charge to all individuals living in the U.S., regardless of immigration or health insurance status. Therefore, vaccine providers cannot require proof of identification or insurance from patients in order to receive a vaccine. In this video, we will break down different forms of documentation and what vaccine providers can and cannot do in terms of requesting information. I want to stress the importance of this video and the information contained within it. We were informed by our community partners that some vaccination sites were denying a patient a vaccine based on their immigration status. Not only was that illegal, it likely deterred those individuals away from receiving a vaccine in the future. Because of this, it is critical that every vaccine provider is fully aware of the documentation criteria. As this slide clearly displays, no documentation of any kind is needed to receive a vaccine. Under the CDC COVID-19 Task Force position on citizenship and residency, proof of U.S. citizenship is not required for individuals to receive a vaccine. In local jurisdictions or vaccination sites cannot add this requirement as a condition for vaccination. This includes needing a birth certificate, passport, or certificate of citizenship. Generally speaking, a health insurance card is also not required to receive a vaccine. As we will discuss in greater detail in the next two slides, health insurance status is only used to determine a route a provider will take for reimbursement. Providers should ask patients if they have health insurance. However, patients that do not provide this information should still receive a vaccine. A Social Security number or driver's license number should only be requested from patients that do not have health insurance, as providers are required to request this information by the HRSA COVID-19 uninsured program. We will discuss this further in the following slides, but providers should still administer vaccines to patients who do not provide this information. Proof of identification can include items like a birth certificate, driver's license, a piece of mail, or even a work badge. Some sites have requested proof of identification to confirm a patient's appointment, but sites cannot require identification in exchange for a vaccine. Finally, a vaccination card is not required for a vaccine. Vaccination cards can be used to verify what dose is needed, but patients who do not have their card can be looked up and verified on IRIS. More information on IRIS can be found in the toolkit. It is important to acknowledge this information is specifically in regard to the COVID-19 vaccine. As previously mentioned, because the federal government is covering the cost of vaccines, a patient does not need health insurance to receive a vaccine. A patient's insurance status simply determines the route of reimbursement a provider must take. If a patient does not have insurance, providers will be reimbursed through the HRSA COVID-19 uninsured program. In order for providers to receive reimbursement from HRSA, you are required to request patient information that would verify insurance status. Such information includes a Social Security number or a driver's license number. To make it clear, patients are not required to provide this requested information, and they should still receive a vaccine regardless of whether they provide this information. As long as providers can attest that they asked for this information, you will still be reimbursed. More information on the reimbursement process and instructions on how to submit claims can be found in Appendix B of this toolkit. Additionally, I advise you to refer to the HRSA COVID-19 uninsured program section of the toolkit for recommendations on how to request information from patients in a way that won't cause concern or turn them away. Here is a visual representation of the reimbursement process. If a patient has health insurance, ask them for their insurance card, as the cost of their vaccine will be paid for by their insurance company. If a patient does not have insurance, ask them for their Social Security number or driver's license number. Let them know that they do not have to provide this information and can still receive a vaccine either way. Regardless of whether a patient provides the requested information, administer their vaccine and submit a claim to HRSA for reimbursement. Something to be aware of is when a person's vaccination card has a different name than the documentation provided by that person. This discrepancy has been known to occur in the workplace as businesses began enforcing vaccine mandates. In these situations, an individual's vaccination card might have that person's birth name, while their work ID badge shows a different one, making it difficult to prove vaccination to an employer. While there are a number of reasons why the names do not match, some common ones include people in transition, people who are recently married or divorced, or immigrant and migrant workers. Whatever the reason may be, it is important to understand that it is okay for the names to not match. However, you might need to help the individual overcome this challenge so they can prove they are vaccinated. It is recommended that providers administer a second vaccination card to the individuals working under two names. In doing so, this should help prevent people from trying to get a second vaccination card by restarting their vaccination series. Furthermore, it is important for providers to be empathetic and patient when working with individuals who need a second vaccination card, and recognize that this might be an uncomfortable or nerve-wracking conversation for them. In summary, a patient can receive a COVID-19 vaccine without providing any form of personal information. Thus, under no circumstances should a patient be turned away from a vaccine. Providers cannot require proof of identification or proof of insurance in exchange for a vaccine, and it is illegal for vaccination sites to refuse a vaccine to a patient who doesn't provide this information. Again, the information in this video is incredibly important. Refer back to this video in the section of the toolkit as needed, and let's work together to stop the spread of misinformation about needing documentation for a vaccine. Here are the references for this video. In the next video, we will go over the process of administering the vaccine and how to create a welcoming vaccination site.